So the question is medical marijuana real medicine? Absolutely. It's not just real medicine. I believe it's the ultimate medicine because it's patient-centric. You get to choose. But what makes it better? Let's compare. Let's just start with pain. What happens when you have bad pain over time? First, they give you so much over the counter. Tylenol, ibuprofen, right? Those have their own side effects if you take them long enough. One kills your liver, the other kills your kidneys. And that's not working for pain. What happens? They add other medicines. Maybe they add a gabapentin. Maybe they add a Lyrica. And we keep adding medicines because we're trying to avoid opiates. Then we're adding muscle relaxants. And you've got all these side effects, and yet your pain's still not under control. Ultimately, someone gives you an opiate. Okay, now you're getting some pain relief, but now you keep taking the opiate. What happens? Less response, less pain relief, increased side effects. And then what's next? Then you get addicted. So it's this vicious cycle of uncontrolled pain. And then you can't control your pain. You can't exercise. You gain weight. You get more pain. Horrible. Who would really volunteer to go on that treadmill and just keep taking opiates? Makes no sense. Let's compare that to what happens with cannabis patients. Medical marijuana is patient-centric. That means when you figure out how it works for you, you choose your strains, your ingredients, your sativa, your indica, your hybrid. You choose whether you want to add CBD when you put the two plants together, more medicine, less impairment. That's another option. You choose whether you want it to go in fast or whether you want it to go in slow. But ultimately, what do you get? You only take the medicine when you need it. It gives you pain relief. You don't get addicted. You don't need escalating doses. And gradually what happens is first you get better pain relief with your cannabis, and then you can start weaning off all those other medicines that are no longer helping you and harming you. But remember, get steady state, get pain control first, learn your cannabis well enough that you have that toolkit to take care of your pain. Then very gradually, with the supervision of your docs, of course, I want you to gradually come off your pills. But I can tell you, happy patients on follow-up, that's the first thing they tell me when I see them the next year is not just that they're off medicines. People tell me exactly which medicines they got rid of. And it's not just opiates and muscle relaxants. But many patients are extremely happy to get rid of buying a 500-pill bottle of Advil, Naprosyn, Tylenol, any of those can be replaced with cannabis. Not instantaneously. It is a learning curve. It is a project. But if you take your time and do it right, yes, most people would actually replace a lot of traditional pharmaceuticals with medical marijuana.